In this episode, we discuss the role as a director of advertising and promotion. Is this job typically done in-house or is it typically outsourced? What are the biggest advantages and disadvantages of using in-house staff for ad promo? What are the pros and cons of using outside contractors for ad promo? How does one get embedded as a contractor or as a full-time employee? What advice do you have for new regulatory professionals to become more embedded and add value? Is the shift from the FDA to the FTC affecting ad promo training? And finally, is there an opportunity for mentorship for new reviewers? Our guest is Heather McFalls, the Director of Promotion Compliance at Otsuka Pharmaceuticals. And I am Darshan Kulkarni, Principal Attorney at the Kulkarni Law Firm. I focus my attention on FDA-regulated companies and their service providers, including issues involving medical affairs, clinical research, and drug advertising. Let's get into it. You are a Director of Advertising and Promotion. Could you talk a little bit about what that role involves? If you like this type of content, please like, subscribe, share. It really helps the channel.
My job really is to look out for, our company and patient safety, and FDA and FTC put out the regulations and the guidances to direct consumer and HCP and payer communications. And it's kind of our job to say, okay, here are the lines of what we can talk to, how we can talk to it, how we should talk about it. We also get involved in things like labeling. We advise labeling teams. We talk about things like phase 3 clinical trial development. What are the things that we want to be able to say at the end of our program? And are there ways that we need to set up our trial in order to successfully be able to say that, assuming your data shows what you hope it's going to show? Is it generally a job that is completely done in-house, or do you tend to see people doing it where it's outsourced? That really depends on the company and how they want to set it up. A lot of companies have an in-house team that does all the reviews. Some companies do a mix, right? They might have like their main products with in-house people, and they might have smaller or established brands, maybe with a contractor that comes in, and some outsource everything. They have somebody who manages the contractors, and they have all contractors working. It just kind of depends on how the company wants to set it up.
But what has been, in your experience, the biggest advantages, biggest disadvantages of using inside people to help with ad promo?
I think one of the big advantages is you really have someone embedded in the entire program. Theoretically, if you're really embedded, you're working on the labeling, so you know what's upcoming. You have input into that. Like I said, you have potential impact on not only phase 3, but if you have phase 4 or you have ongoing clinical trials, you're involved in that and can kind of help position for long-term strategy. I think that is really helpful. Plus, you tend to keep the institutional knowledge in-house of like why we made these decisions and what things have we tried with FDA. And I think the contractor doesn't always have that advantage, or sometimes just gets thrown in and is asked to just kind of dive on and do the best they can. And of course, being total pros, they're able to handle applying the FDA regulations, and they're usually given access to internal standards. But you do kind of lose that institutional knowledge. So I think that's definitely an advantage. Disadvantages can be things like, it takes a lot to do our job appropriately as well. And I think it takes a little bit more time than is sometimes assumed, which makes it really hard when it's like, oh, can you turn out A, B, C, and D like all in the same time period? Or, we need X, Y, Z, whatever. And things you need to prioritize, right? And not everybody likes where they end up on the priority list. Whereas if you're a contractor, generally you're not, unless you're fully embedded, you're generally not as involved in all of the other internal parts of it. And you're not on call as much, right? Because you're working contracted billable hours.
Can we do the exact same thing from the perspective of using outside contractors to help you? What is a big advantage of using them and the big disadvantage? For the company, what are the advantages and disadvantages?
I feel like sometimes contractors can be faster in the sense that, they're contracted for a very specific purpose, like get this product on the market or, review these pieces. And so You obviously have the SOPs you need to take and things like that and get a little bit of the drug background or therapeutic area, but you can come in and immediately start reviewing pieces to, the standards that you're familiar with. So in terms of if you're only concerned from a company perspective, like just getting it out there immediately, that can be an advantage, right? Can be detrimental both to the contractor and to the company long term to do it that way. But it's certainly an upfront speed advantage, I would say.
How does one get embedded? What are the big ways to achieve that goal?
A lot of the contractors in our business go through like one or two main companies, and they approach it different ways, right? Some companies don't want a full-time employee, but they want someone who essentially all of their time is devoted to them. And so they'll contact the company and put that out for the contract. We want somebody who's here for us 40 hours a week, whatever it is. Others are just like, hey, we just need someone to cover, or we only have the budget for whichever one, 20 hours a week. And so they'll contact through the companies for that. If people are doing it independently, it's just going to depend on what the companies want and how much time they have, right? Do they want more than one client? Do they want to try to get one complete client?
And if you are a new upcoming regulatory person, you want to get more experience, you're working in-house, what do you, as a director, advise these new regulatory people, whether they're PharmDs or whether they're something else, on how they can be better embedded and add more value to the company?
One, never stop asking questions. Ask everybody questions, all the questions. Doing this 10 years, I still ask questions all the time. It is not every situation is the same. It's important to understand why other people are thinking the way they do, because ad promo is not really an art, not really a science. It's a mix of the two. And there's a lot of gray in the space, right? And so there isn't necessarily a right or wrong answer, but understanding how other people are approaching things and why they're approaching things that way can really give you a lot of information. Definitely read past FDA letters. It is one of the best resources you have for understanding, how they were thinking, how that thinking has evolved, or how the thinking has stayed consistent over decades, right? And I think that is important to understand. And the third thing is understand your own company's history, your own product's history with the FDA. Not only for advisory comments or launch comments, but also, what have the reg liaisons worked on? What kind of filings have we done? And how has FDA responded? It can really give you a lot of insight. For instance, if you have a REMS program, any REMS communication can tell you which pieces of patient safety the FDA specifically focused on. And so it might not be a direct translation to your ad promo pieces, but it can help tailor your comments. So I think all of those things are really useful as you continue to learn and grow.
What's interesting, as we both know, is that the number of FDA letters has precipitously dropped. Yeah. Do you feel, and interestingly enough, the number of FTC letters is kind of increasing at the same time. Yeah. As you see it, is this having an impact on the training of individuals who are now coming in? Or are they sort of learning just based on the past letters? Or has the type of ad promo that is expected, has that changed?
I don't necessarily think training has changed. Your principles really remain your same. The laws haven't changed since 1960, 7, whatever. So that remains consistent. I think what has changed is companies' willingness to take risks and their ability to drive forward new initiatives that they want to do, because there's not a whole lot of feedback coming back from FDA outwardly, right? That we like you to watch your communications in this area. I think a lot of the First Amendment lawsuits over the last few years have really slowed that pace and made it a little bit more dicey to find that footing. And so I think as a new ad promo reviewer, everything feels like it's the same level of risk, really hard to differentiate. And understandably so, right? We take risks on behalf of the company every day. The more experience you have, the more practice you have, and honestly, that really just comes with time. You can sort of begin to differentiate. So I do think that newer reviewers are somewhat at disadvantage in that way with the less letters coming in, because there's not as much current feedback coming through.
Has this become an opportunity for mentorship to guide these newer reviewers, or do the newer reviewers see this as the new normal?
I actually think it's more important for mentorship. If there's not a lot of current feedback coming in, I found this successful in my career, both when I started and now that I've got more time invested with younger reviewers or newer reviewers, to say, okay, this is how I'm approaching it and this is why. And, I think it's also important to emphasize that, like, that doesn't mean you're going to feel this way. That doesn't mean that this is how you are going to judge this at the end of the day, right? Like I said, there's a lot of gray in there, but that's why you want at least one mentor and other people that you can talk to.
Heather, this was amazing. Thank you so much for the conversation so far.
You're welcome.
For assistance with your advertising compliance needs, feel free to contact us at Darshan@Kulkarni Law.